Restylane removed before pinch blepharoplasty? I'm a 42-year-old female that had Restylane injected in my tear trough 2 months ago. The results were only so-so. I still have dark circles, most likely from genetics and possible skin staining. I still have excess skin that I need to address. I'm considering a pinch blepharoplasty. Should I have the Restylane removed before the bleph to get the best results from surgery?
Thank you for your question. You've had Restylane injected in your tear trough, and as you described in your question, your results were only so-so. You feel like you have excess skin, and you're considering a pinch blepharoplasty, and you want to know, should you remove the Restylane before you have the blepharoplasty? Well, you submitted some photos that are very helpful, but I would caution you about making the choice about a pinch blepharoplasty to begin with. Now, this is all based on the photos you submitted and not based on physical exam, which is the great limitation here when questions are submitted this way. To understand what you perceive as excess skin and there's a distinction that needs to be made. I wrote a book called The Fine Art of Looking Younger, and I teach my patients on a daily basis that facial aging is volume loss and descent. Now, at your age, although there is certainly some changes in terms of the shifting of the tissue or the stretching that happens with aging changes, it is, in my opinion, that you are dealing more with volume loss. And you're dealing with volume loss at several levels, which is why a single solution is not the perfect solution. Let me explain. The tear trough area gets a little bit hollow because the soft tissue, the fat, the baby fat in the area between the bone and the cheek, or the eye and the cheek, called the eyelid-cheek area, tends to diminish. The tear trough becomes a little bit deeper. So certainly placing Restylane in that area is a good way to help soften that real change. Now, when it comes to the relative excess of skin that you're concerned about, remember there's a difference between skin texture and skin excess. When I look at your photo, I don't get the sense that there's a lot of skin excess. And when I look at the way the eyelid is shaped, it almost makes me more concerned that if some skin were removed, it may pull your eyelid down. So, if a strategy for you, and on physical exam, if the doctor can roll skin and there is really a true excess, then my approach would be typically is that if I'm going to do a skin pinch removal for the blepharoplasty, I also do some type of canthal tendon reinforcement. That basically means reinforcing the tendon that holds the eyelid in position in order to prevent the eyelid from pulling down. There are many patients who come to our practice over the course of 20 years who have had skin removed in the lower eyelid, and it causes their eyelid to either evert, pull down, or both. So I'm extremely sensitive to that being a risk. Sometimes in our practice, how we approach the perception of redundant skin is by addressing the texture of the skin. To address the texture of the skin, we employ technologies such as fractional CO2 laser and platelet-rich plasma. The idea is that as skin texture becomes thinner, or I should say the skin thickness becomes thinner, then what we want to do is build up collagen and improve the skin quality. So instead of removing skin, what we try to do is add some quality to the skin by injecting platelet-rich plasma. What that is essentially using your own blood and concentrating the factors and the cells called platelets, which are used in healing, and in effect heal the aging changes by increasing the volume of collagen. So it's like going for a regular blood draw and then we spin your blood and we inject it under the skin. The fractional CO2 laser stimulates and improves the skin quality both through a thermal energy delivery and a very fractionated, which means multiple little dots with some skip areas, so that the top layer of skin also is refreshed. So that combination may be worth considering before you go ahead further with the eyelid surgery. So as straightforward as it may seem, lower eyelid rejuvenation, as you can have already started to discover, is addressing a volume loss in the hollows, addressing the textural changes in the skin, and also dealing with structural issues such as fat prolapse, as well as the canthal tendon or the support structures of the lower eyelid. So my advice is to do some more research, meet with some highly experienced and qualified cosmetic surgeons, and learn more about your options, and be clear about what expected result will be satisfactory to you, and hopefully you'll find the right combination of treatments that'll help you look the way you would like. I hope that was helpful, and thank you for your question.